The world is fighting the worst Ebola epidemic in history. With no vaccine or cure, we are facing down a disease for which there is no room for error. We have been told, quote, virtually any hospital in the country that can do isolation for Ebola, unquote. The events in Dallas have proven otherwise. How do healthcare workers wearing full protective gear still get infected? Can it be transmitted from a person who does not yet have a high fever? Both CDC and NIH tell us that Ebola patients are only contagious when having a fever. However, the largest study of the current Ebola outbreak found that nearly 13% of confirmed cases in West Africa did not have associated fever. I want to understand why CDC and the White House changed course in 2010 on proposals first introduced in 2005 that would have strengthened the federal quarantine authority. I restate my ongoing concern that administrative officials still refuse to consider any travel restrictions for the more than 1,000 travelers entering the United States each week from Ebola hot zones. A month ago, the President told us someone with Ebola reaching our shores was unlikely, and that we've taken the necessary precautions to increase screening at airports so that someone with the virus does not get on a plane for the United States. Screening and self-reporting in airports have been a demonstrated failure. Yet the administration continues to advance a contradictory position for this failed policy that frankly doesn't make sense to me. It troubles me even more when public health policies are based upon a stated concern over cutting commercial ties with fledgling democracies rather than protecting public health in the United States. We do not have to leave the door open to all travel to and from hot zones in Western Africa while Ebola is an unwelcome and dangerous stowaway on these flights. I'm confident we can develop a reasoned and successful strategy to meet these needs. The current airline passenger screening at 5 U.S. airports through temperature taking and self-reporting is troubling. Both CDC and NIH tell us that the Ebola patients are only contagious when having a fever. A determined infected traveler can evade the screening by masking the fever with ibuprofen or avoiding the 5 airports. Further, it is nearly impossible to perform contact tracing of all people on multiple international flights across the globe.
I guess to more directly address your question, what we were looking for is not an Ebola expert, but rather an implementation expert. And that's exactly what Ron Klain is. He is somebody who has extensive experience in the federal government. He's somebody that has extensive management experience when it comes to the private sector. Because again, ultimately what we're looking for here is an implementation expert.
President Obama has named Ron Klain to be the first ever Ebola czar. He'll oversee the government's response to cases of Ebola here in the United States. He'll also advise the president on what action needs to be taken. Before this, the 53-year-old Klain served as chief of staff for both Vice President Al Gore and Vice President Joe Biden. ABC's John Ehrlichman takes a look at the latest developments on the Ebola situation.
Her condition is fair, she is stable, and she is resting comfortably.
Her co-worker, Amber Vinson, the second nurse at Texas Health Presbyterian Hospital to contract Ebola, is now being treated in a top biocontainment facility in Atlanta. New questions are now being asked about whether she was ill before she boarded a commercial flight from Dallas to Cleveland. Her mother says much criticism has been offered because she chose to travel home. Let me be clear, Amber wasn't sick when she came home, and she wasn't symptomatic when she departed for Dallas. All this as the investigation into how both nurses contracted the deadly virus intensifies. Brianna Aguirre, a nurse at the same Texas hospital, describing the scene inside.
This is what makes me so upset right here. Her neck is hanging out.
Texas has now restricted the 75 healthcare workers being monitored in Dallas from using mass transportation or congregating in public.
Meanwhile, President Obama has appointed Ron Klain, a former White House official, to be his Ebola czar, essentially playing point on all these many moving parts. John Ehrlichman, ABC News.
The nurses in the MICU, from the time they had first contact with Mr. Duncan, were in personal protective equipment according to the CDC guidelines.
Mm-hmm. So they were already using universal precautions, but also had were using some of the more isolation. And just answer yes or no.
Yes.
Okay. Now, you had mentioned, and I believe the quote was, unless it mutates, there will not be an outbreak here in the United States. Is that correct?
There will not be a large outbreak here, barring a mutation.
Well, the question I have is, when the nurses were using the protective gear then, how is this that this has happened? It tells me that something is changing here, and are we Are we currently looking into this situation right now?
We're absolutely looking for other mutations or changes. What we've seen is very little change in the virus. We don't think it is spreading by any different way.
So and you've already said a couple of times that you don't believe that this is airborne, and yet, there again, I know how nurses are. I was one for 21 years before coming to Congress. You're protecting yourself, you're protecting your patient, you're protecting your family. They followed precautions, I am sure, and now we're having this conversation, and I'm very concerned about that.
We are confident this is not airborne transmission.
But ultimately, we are all connected by the air we breathe, and we are invested in ensuring that the disease is controlled in Africa, but also in ensuring that where there are patients in this country who become ill, they're immediately isolated, and we do the tried and true core public health interventions that stop the spread of Ebola.
Do you need a fever to be contagious?
You need to be sick. Generally, the first symptom of illness is fever.
So do you need a fever to be contagious?
Late in the disease, when people are deathly ill, they may not have fever, but they would be likely to be able to walk at that point.
This 21-day period that you need to show symptoms within 21 days from exposure, during that could you be contagious at the third day of that point?
Only if you were sick, only if you had symptoms.
Okay. And the incubation period is anywhere from 0 to 21 days?
2 to 21 days, generally within the first 10 days or so.
You said here today that there's 100 to 150 people a day coming from West Africa into the United States. You're opposed to travel restrictions, which the constituents in the 7th District in Missouri are very much in favor of travel restrictions. I predict you're going to put on, or the President's going to put on, travel restrictions. I don't know if it's going to be today or tomorrow or 2 weeks or a month from now, but I think that they're coming, and I think sooner rather than later. If there's 150 a day and you rationalize, well, we don't really need to worry about that because they could get cross borders, they could go by land and then get here. If that 100 and 150 a day, don't you think that number might be reduced to 5 or 10 a day if we did put on travel restrictions?
I can't comment on what numbers would.
If someone had to make an effort other than going out to their local airport and jumping on a plane, if they really had to try to get here, don't you think that number would dramatically drop?
I know that people do come back, and right now we're able to screen them, collect their information.
What if they don't come back? A lot of people come in this country and we lose track of them. They don't come back. What happens then? My point is, if you got 150 a day coming in or you have 5 coming in today, I and my constituents would rather have 5 a day coming in. And this thing of checking for temperatures like it's going to help is kind of like scrubbing a plane that doesn't need to be scrubbed. But I'd like to commend the folks reading this copy of Bloomberg Business Week. Ebola is coming to America. The U.S. had a chance to stop the virus in its tracks, but it missed. That issue came out before Mr. Duncan came to this country and before he was diagnosed with Ebola. There's some good reading in there that I would recommend. I'd also recommend, too, if you want to Google, a hospital from hell is swamped by Ebola. The New York Times, just a few days ago. Hospital from hell. If you get a chance to read that, I think that everyone would be in favor of the travel restrictions we've talked about here today. And today, OSHA, Occupational Safety and Health Administration, just today said that Customs and Border Patrol immigration enforcement agents are at risk of coming into contact with Ebola. Mr. Wagner, are we prepared for that? Are your agents, are they protected to the fullest extent what they need? This just came out today.
We issue them personal protective gear, and we train them on how to wear it and what circumstances to wear it. But they encounter all different kinds of travelers with a whole host of different potential communicable diseases. So, you know, we are aware and we do train to recognize signs of over illness, and then we have the protocols with the health professionals to get those travelers into that care and to protect our employees.
To me, they fall in the same category of the nurses. They're there to save us and help people and protect people in this country. So God bless them. I'll yield back.
I believe we need an immediate ban on commercial non-essential travel from Guinea, Liberia, and Sierra Leone until we have an accurate and thorough screening process and we treat this disease.
And urging the President to immediately institute a travel ban until such time that they can firmly and scientifically prove that Americans are safe from having more Ebola patients coming into the United States. And I know, Dr. Frieden, you expressed disagreement with that. Have y'all had any conversations within the White House about a travel ban and whether or not the President has the authority? Because many of us have said the President does have the authority to do it today.
From the point of view of CDC, we're willing to consider anything that will reduce risk.
But have you considered that? And have you ruled it out, or have you not considered it at all? Have you had conversations with the White House about a travel ban? That's a yes or no question. Have you had conversations with the White House about a travel ban?
We've discussed many aspects.
How about a travel ban? Have you had that conversation with anyone in the White House?
We've had discussions on the issue of travel to and from West Africa.
And have y'all ruled it out?
I can't speak for the White House. I can tell you that
you can speak for the CDC. If you were in those conversations, maybe they had their own conversations without you, but if you were involved in conversations with the White House about a travel ban, did they rule it out? Are they still considering it?
From the CDC's perspective, we will consider anything that will better protect.
So are you going to answer the question about your conversations with the White House? Is the White House considering a travel ban?
I can't speak for the White House.
Do you know if they've ruled out a travel ban?
I can't speak for the White House.
Have you had conversations with them about it?
We've discussed the issue of travel.
All right. I would urge you, at a minimum, if you've ruled out a travel ban, if you don't think it's the right way to go, there are a lot of people that would disagree with you. At a minimum, you ought to look at least immediately suspending visas to non-U.S. nationals seeking to travel into the United States from Sierra Leone, Liberia, and Guinea. Have you all considered that or discussed it or ruled it out?
At CDC, our authority is to quarantine individuals or require the isolation of individuals.
But earlier you said you don't think there should be a travel ban. What about at least looking at suspending visas to non-U.S. citizens? Have you looked at that?
CDC doesn't issue visas.
But you can make a recommendation to the White House that it would be in the best interest of the American people to have that kind of suspension issued, can't you? Are you not aware of that?
We would certainly consider anything that will reduce risk to Americans.
Let me ask you this. Do you have a high level of confidence that our U.S. troops that are over there right now, I've got estimates that around 350 U.S. troops are already in those 3 affected countries. Up to 3,000 troops are going to be sent over by President Obama. Do you have a high level of confidence that those U.S. troops are protected with all the protocols in place so that they will not contract Ebola?
We've worked very closely with DOD on their protocols.
So do you have a high level of confidence that they're protected?
I would not say that there's zero risk. They are in those countries, but they are not participating in high-risk activities that would put them at risk. Are you
consulting with DOD? Who establishes the protocols in that case? Is the CDC involved in that?
They are following the CDC protocols, but they follow their own.
Let me ask you about the protocols, because I've read reports that some people with some of the other organizations that have been over there for a while, you've got the group Samaritan's Purse, a gentleman by the name of Sean Kaufman, who's involved with some of the doctors that have been over there that have gotten infected. They've been working for decades in some cases. He said that he warned your agency that the guidelines that you had on Ebola were lax, and his response was, quote, "They kind of blew me off," meaning your agency blew him off when he was warning you that your protocols were lax. Are you aware of that?
I saw that quotation. We take all suggestions.
Have you identified who blew him off in your agency?
I don't know that occurred.
Well, I would hope that you'd go and find out, because there's a real concern. You know, one of the biggest concerns I get from the hospitals in my district that I've talked to, and I've talked to a number of hospital officials, medical officials, professionals in my district, they're concerned that they haven't had consistent protocols. There's been at least 4 just in the last few weeks where the protocols keep changing. Now, with the nurse, the first nurse that was infected, I believe you personally said that the protocols were breached originally. Have you backed away from that?
We're looking at what might have resulted.
You said the protocols were breached. Were the protocols breached with the first nurse that was infected? Yes or no?
Our review of the records suggests that in the first few days
if you didn't know for a fact, you shouldn't have said it. Do you withdraw that statement, or do you still stand by the statement that protocols were breached by the first nurse?
There was a definite exposure that resulted.
Were protocols breached, yes or no? Yield back.
Thank you.